Hi, in this video, I'm going to show you the different parts of the femur bone. There's a head, a neck, and if you look closer in the head, there's this pit called the fovea centralis. So fovea centralis, head, neck. And there are these two bumps here. The big bump is called the greater trochanter. The small bump is called the lesser trochanter. And if you look between them, there's this ridge, kind of this little mountain ridge that attaches the two. And because this is between the trochanters, we're calling it the intertrochanteric, which means between trochanters, intertrochanteric crest, which means ridge, like the ridge of a mountain. So if we keep going down here, we're looking now at the posterior side. That's where it's easier to see these greater and lesser trochanters. Here, this is a line called the gluteal tuberosity, and if you follow it all the way down, it becomes a straight, more prominent line, and that's called the linea aspera. Keep going all the way down, and there's this indentation called the intercondylar fossa. These things that hang down, they're called condyles. Since this is between the condyles, intercondylar, which means between condyles, fossa, which is a shallow indentation. So condyles, intercondylar fossa. Now if we turn it around, now we're looking at the anterior side. This area is called the patellar surface. It's where your patella or your kneecap sits, and as you bend your knee, that patella just slides back and forth. So that's your patellar surface. These are still the condyles, whether you're looking at it from the posterior view or the anterior view. And this is going to be a right femur. The head is going to face your head, just like the head of the humerus faced your head. And then down here, the patellar surface has to be anterior, because your kneecap, or your patella bone, is on the anterior side of your body, not posterior. That would make this a right femur. So if this is a right femur, then so that is going to be facing the medial side. That means this is the medial condyle. This is a lateral condyle. Epi means around, like the epidermis was wrapped around the dermis or over it. This is the epicondyle. That is an epicondyle. Well, since this is the medial condyle, that's a medial epicondyle. Since this is a lateral condyle, this is a lateral epicondyle. So those are some of the things that you will be asked to identify on the femur. Thank you for watching the video.